screen. So the recordings. Hello, welcome to Casual Conversations. My name is Katherine Snedaker. I'm a licensed clinical social worker and the CEO and founder of Concussions. I'm very excited to be yet again here on a Thursday, hosting Casual Conversations for brain injury professionals, and hosted by IBIA and NABIS. And today I have a very special friend of mine, Jessica Schwartz, Dr. Jessica Schwartz, to share her experience, her current work, and what she sees in the future of brain injury. Welcome to the show, Jessica.
Oh, thank you so much for having me, Katherine.
And this is kind of ironic because how many times have I been on your podcast?
I think two, and then I have two more episodes like Concussion Shorts that we haven't launched yet. So I think we have like four, I think, in the boat here. So yeah, you've been on, and we're an early, I think, one of my first 5 podcast guests in 2018.
And I remember when you started that podcast, I think it was the first, if one of the first, and you were out there. How many episodes did you end up doing with that podcast?
Yeah, so we're still going. We have a new project going on. So we've got about 12 episodes just kind of in the vault, ready to roll. So we will start putting those back out in the next 2 weeks. And gosh, I think we just posted our 70th or 71st. We're going to cross 100 pretty soon.
That's amazing. Well, let's start at the beginning.
Sure.
Before you were Dr. Schwartz. Why don't you tell us where you'd like to jump into your childhood, adolescent, teen years that sort of led you to where you are today, or at least led you to the medical field?
Sure. I love this. This is so like licensed social worker. I appreciate this so much. We're starting from the ground up. Yeah. So just a shout out to my mom as well. My mom was an MSW, got grandfathered into the LCSW, and she retired in 2017. So I appreciate coming from that lens so much. Golly. So let's start. I am an only child. I was raised by a single mom here in New York City. And I was an athlete all my life. I was the little kid. I mean, I was accident prone, to say the least, but I was definitely active. I played boys baseball until I was 16. I was a 4-sport athlete in high school. I played softball. I played an order of season. I played volleyball, basketball, softball, and baseball, and tennis. And tennis I excelled at, and basketball as well. And I was about 13 years old, and it was the most like quintessential New York City story. And normally this would be like a stranger danger situation. And I was playing boys baseball on first base. They didn't want me to play baseball, but my mom went through the Title IX. You know, they're like, you have to let her try out. And they let me try out. And I was 12 or 13 at the time. This was after like we had T-ball, and then we had to like feed the ball through the machine. And then we had, that's when things kind of split from boys and girls growing up from a gender approach. And they put boys in baseball and girls in softball. And I didn't want to play softball. I really loved baseball. And so they let me try out after a little bit of hullabaloo. And I was a first round draft pick as a 12-year-old girl, right? So you can imagine, you know, so, and I was playing baseball. I was on first base, and one of the dads was kind of like hanging on the other side of the fence by Con Edison here in New York City. It's very, not so beautiful, but it was a nice field. And he was like, hey, what are you doing here? You know, playing boys baseball. Why don't you come down to the rec center and play basketball? And so as creepy as that sounds, my mom vetted him. He was one of the dads on the team and on the other team. And I started playing basketball. And lo and behold, I was pretty good. I was getting recruited by some Division I schools. And life changed when I was 15, going into 16, summer at a camp in Rhode Island by myself. I tore my ACL. And that was kind of the start of, boy, you know, what are you going to do with your life, Jess? And one of my mom's friends is a physician at work, and he was a pediatrician. And he said, Jess, why don't you become a physical therapist? It was literally this conversation. I was on his kitchen floor and stretching and playing with the dogs after my ACL injury. And he was like, why don't you become a physical therapist? It's great. You can become a doctor of something. It's new. And then you can help people, and you're constantly moving, and you can work with athletes. And that was kind of the trajectory of my life there. I became a PT. I knew it from day one. And I couldn't have come more full circle. I mean, after my own concussive injury, I I was asked to become one of our national spokeswomen for the American Physical Therapy Association. And I couldn't have more gratitude for that moment in 2015 when the head of PR reached out.
So let's go back to what did you learn about concussion through your educational experience in the medical care?
So what was going on is I did my residency in orthopedics in 2010. We were the first 6 in New York City to do a residency in orthopedics at New York University. And at that time, it was our last weekend to finish in 2011. And my best friend from Italy, we had 2 international residents in our first inaugural cohort of 6. And I still keep in touch with all of them to this day. And we saw that there was a conference at NYU Langone, and there was for concussion in 2011. And it was our first weekend off from residency. So you can imagine we were exhausted, running on fumes, did all of our research and work. And she's like, do you want to go? And I was like, yeah, let's go. So we went to the concussion conference in 2011, which was the first one at NYU at that time, before they had their.
Meet there? Is that where we met?
We met in 2014. So
Okay,
that was a few years later. Yeah. So this was when I was a resident. We met after I was concussed, you and I.
Okay.
And then I was working at a wonderful clinic in New Jersey. I was just promoted the week I got hit, actually, to junior partner at my company. So that was a big deal. And then I got hit by a car on October 3rd, 2013. Before that, we actually started within the last 12 months, we actually started the only rehabilitative concussion program in the state of New Jersey to practice a rehabilitative approach to concussion. And fast forward now, I mean, Carrie Kruger.
I want to make sure I get the timing right. So you had gone to a concussion, you'd gone to the NYU conference, you had set up the concussion rehab, like everything was all set up, and then your accident, then your accident happened.
Yes. Some of my coworkers set up the concussion program. Actually, it was not me at the time. I was actually the director of our civilian prosthetics program at the time. So our servicemen and women get tremendous care from the VA for prosthetics and orthotics. And what I found in the community is that a lot of our men and women and children weren't getting that quality of care just due to access issues. So I started my own program there, kind of on the other end of the spectrum, right? With the P&O side of things. But we just happened to have a breast cancer, concussion, and our P&O program, so that I led.
So tell us a little bit about your accident.
Sure. So I had a great job. I actually had to reverse commute. I left New York City and I would leave New York City 3 days a week, Monday, Wednesday, Friday. I worked a 13 1/3 hour day. So I would drive an hour out to Northern New Jersey. I would come an hour back at home. We would finish at 9:30 at night. And so that was about a 15, 16 hour day. It's a big day. But then we'd have the other Tuesday, Thursday to recover completely on the weekend. So it was a 3-day on, 4-day off, which was great. And I was hit. It was my off day. I saw a morning private patient about 45 minutes away from my home. And I'm into tech, and I was actually picking up my iPhone at Best Buy on the way home, and was going to go see another patient. So in between that time, driving in between patients, I was stopped at a red light in New York City on 12th Street between 5th and 6th Avenue. And I was hit by an unlicensed driver from behind. I was at a red light and I didn't see it coming. It was kind of like New York City traditional traffic. I was probably on that street for 2 or 3 lights. So I wasn't looking for a race car to be coming behind me and just not stopping. I mean, we were there for a long time. So I was actually plugging in the new phone at the red lights and looking down. Didn't see it. My head was down and rotated, which I think was important for my recovery trajectory. And I was pushed about 30 feet. I had to go from 0 to the putting on the brake, the emergency brake. And I got out of the car to I'm a true New Yorker, right? So I got out of the car to give the guy the business. And I was incredibly dizzy. I just did not feel good or well or right. And I grabbed onto the top of my car. It was a small Toyota Prius. And I said, okay, I need to sit down. And again, like most healthcare providers in this country, I have student loans and student debt, and, I was afraid to go to the hospital. And so I called my boss at the time. I just got promoted that week. And he's like, Jess, no, you got to go in. You never know what can happen. Go in, make sure you're okay. I left my car there. I went in the ambulance with my briefcase and computer. And I was in the ED and I was going through the CAT scan with my clinical prediction guidelines for the Canadian head CT rule. I was just finished residency, and I was like, I'm 30 years old and shouldn't be scanned right now. And they scanned me. And I will say that every single doctor after that asked for my CT scan, which I thought was always interesting. And that was it. What I thought was just a concussion turned into 10 to 14 hours of rehab a week for 14 months.
And what were your symptoms sort of in those first weeks after your accident?
Sure. So initially, we thought it was just a concussion, which is language we'd never use now. It's not to be crass, but we don't call it just diarrhea or a small pregnancy, right? Those are things that have a trajectory. So I thought that I would be sore for kind of like a whiplash injury for days to hours to days, or if not weeks. And I didn't think anything of it. Initially, I had migraines and light sensitivity and fatigue. And that turned into just kind of everything kind of compounding on one another. I went back to work after the week, and I was actually, interestingly enough, now I know a lot of my issues now were ocular motor driven. So for example, for anyone that's in the room that has either gone through this or is a provider, essentially I could treat a shoulder patient looking down. It's easier to converge looking down in that distance, as opposed to keeping a horizontal gaze and treating an ankle patient up here and having to look down to plant the table. So I was having a difficulty with certain patients, and I didn't understand why. And then I was completely fatigued, right? That was a really long day. So I'd have to lay down between lunch. We completely shut the clinic down between 1 and 2 p.m. And I, instead of being social leader Jess on our team, I had to lay down and completely reset. And I wasn't making it to the end of the day.
You were still doing that drive. You were still doing that 1 hour drive there. Then
yes.
And then the 1 hour drive back.
Yes, and I was very fortunate at that time to have my work husband, quote unquote. We would carpool together from the city. So for those 2 weeks that I went back to work, he actually drove my car home either with me in it, or he would just drive on that way back. We realized that I couldn't do it.
And what advice? I mean, and again, it's the year that you're concussed and the knowledge that one has, and the medical protocol at the time. It so seems like every couple of years it's changed. What was the protocol at that time? Were you given the dark room for the first week? Was that even brought up? What were they giving you as a trajectory at that time?
Right. So if we think back to that time now, kind of retrospectively, Monday morning quarterback, right? So if we think back then, it was the 2012 guidelines. So we just started talking about the cervical spine in 2012. And again, that wasn't published until 2013, the year I got hit. So we know that information takes 8 to 10 years to translate into clinic. So you can only imagine. I did cocoon. I had a barrier because I was hit in the state of New York by an unlicensed driver. Therefore, that's a no-fault insurance. So I had the Kobe beef of like insurance with out-of-network benefits, and it was a PPO, and we paid a lot of money for that as a clinic, as a PT-owned clinic that we supported ourselves that way. I was not able to use that insurance. Therefore, I had to make very high-level decision-making, in terms of my care, planning my care, really concussed. So that was really tough. So the first 3 clinicians I saw incredibly mismanaged me. I walked out of one with 5 prescriptions, one of them being for Adderall within the first 7 to 10 days of me being concussed, having never taken anything more than Tylenol. And all I kept saying was that I want to get back to work because I love my job, I love my work. And that was his solution, was to give me Adderall. I mean, so there was so much mismanagement early on, but that was really, if you look at it, in the first month. But it was desperation. I could not find the proper care. And when I finally called NYU, I was told, this was within the first 2 weeks, I was told January 2014. So mind you, I got hit October 3rd and went out on the 2nd week. So that was that felt forever. And they actually bumped me up. I'll never forget it. I got in finally on December 7th, and then life changed after that.
Wow. And I do remember the time that trying to get care was, well, in 6 months, there's a slot. So that
yeah.
I've heard that experience before. And then I do always want to acknowledge the privilege that I certainly have, and my children have had, of their skin color being white, and barriers of racism that we haven't as a family felt, and that so often so many people of color have to even getting in the door.
Yeah, and I advocated for myself like you wouldn't believe. I mean, I knew the language, I knew the vernacular. I was explaining that I couldn't go back to work unless, so, and there was, once you go through the no fault pathway, I mean, it's insane. It's you really need a full team. When I was said and done with everything, I had a 2-3 inch binders to help organize everything because it was just way too much. And not only is this injury of concussion can be an orthopedic and neurological injury, but you're looking at cognitive and behavioral aspects of it as well. So to try to negotiate through a healthcare system of individually competent clinicians that aren't looking at this collectively as a collective competency 360, it was really quite something.
Yeah, and you're white, English is your first language, you had, advanced education, and that's why I asked what you knew about concussion before that even happened. And I think that too often patients just don't I think too often that patients don't realize how hard it is to get this kind of care, and think, oh, if only I'd known more then. And as a person that knew as much as you did, look how hard it was for you.
Yeah, and what I've found in my career is that it doesn't matter if you're a Medicaid patient or a no-fault patient, and I don't like to equate value, but that's how you feel when you're going through this pathway of I am my insurance, because I'm not even allowed to pay cash or see somebody else if you're going through a no-fault car insurance in the state of New York. It was incredibly infuriating that I am not allowed to have my perceived best quality of care from this doctor or specialist because I'm in now someone else's negligence because they hit me with their car. I don't have those options. So it was quite something to go through at that time, especially as women. We don't want to be perceived as angry. And I was angry. I mean, I was pissed. And there's no other way to look at that. That's, not Dr. Schwartz talking, that was patient Jess. And, it was incredibly frustrating there. So to kind of go through that grief cycle, I would say 3 or 4 times during that 14 months, because you kind of go take 2 steps forward and then 2 or 3 steps back until you have to ebb and flow. And that's you really have to understand that nuance as a healthcare provider of, when, carefully working with this patient population.
Looking back now, there's a question in the chat about the scan that you had at the time. Looking back now, are there things that you wish you had recorded or done in those first weeks and we have had lawyers on here, and very often if it's a situation where it's an automobile accident or kind, I will try to have the family have a lawyer as soon as they can to pick up pieces. But from your medical care standpoint, not a legal standpoint, but from your medical standpoint, were there things that you wish you had done in those first couple of weeks?
I wish I didn't cocoon as much because I really didn't know what else to do. Again, I remember I couldn't even go to my own clinic and get treatment, right? Like in New Jersey, like I couldn't even go there. So like legally, like, I don't know, I just felt like it was like one of these warranties with Apple where you can't get your phone serviced anywhere else because of this insurance issue. So no, but I think it's important to talk about the legal, and here's what we know historically, because remember, I just came out of a robust educational experience, right? And we're taught, and I think we need to talk about this as healthcare providers, to like mano a mano, like to each other, and talk about that. I was biased against the legal system here, again, for no fault of my own. I was like literally minding my business at a red light, and I was hit by an unlicensed driver from behind. So I purposely did not get legal counsel because I was educated during my doctorate that folks that, and this is an incredible cognitive bias that we need to talk about in healthcare, is that we are taught as healthcare providers that if people go into the medical legal, like if you go into a lawsuit, their care and recovery and trajectory tends to be retarded, tends to be slowed. So I was like, no, I just showed up like a good soldier. I showed up to therapy 10 to 14 hours a week for 14 months. It wasn't until 2 weeks before my short-term disability ended where my occupational therapist and I really sat down, and she really just had to let myself have it and give that space to, I just lost it, where we realized I was supposed to go back on Cinco de Mayo of 2014 on May 5th, and it was supposed to be a celebration. I had patients writing letters. I had my whole team saying, and what happened is that I was ashamed of myself for saying that I'm going to go back to work based off of a third-party insurance reason of my short-term disability ends in 6 months, not because my brain injury was ready for me to recover to go back to work. How can I take care of a patient if my cup isn't full? And I was so not ready. I was still having oscillopsia at that time. The words were coming off the page. It was incredibly scary. And I was a reader. I was reading about 20 journals a month before my accident. And so that's kind of what happened. I ended up getting a lawyer 2 weeks before my short-term disability. And then I became angry again. And I was very angry at that point. And I got a lawyer at that point because I didn't know what to do. I was 29, 30 years old. And I thought at the peak of my career.
And so at that 18 months to 2 year period, what are your symptoms like at that point?
18 months to 2. Okay. So I went back 14 months later. I went back
that 14-month period, just for, because people, sometimes there's patients that, hear, well, if you aren't better by year one, that's it. And that just is so not true. So I wanted you to talk about, where you were at that 1 year mark and the progress beyond that.
Right. So at 14 months, I went back and I went back and very, very important for folks that are recovering from this injury and or employers that are listening or healthcare providers on how to help folks negotiate back into the workplace. I had an incredibly supportive workplace. I was just promoted to a junior partner. We were very deeply connected to one another. I had to kind of cut everything off. And this is frustrating on both ends, on the employer's end and on the employee's end. And I said, you guys have to stop asking me when I'm coming back to work. I need you to ask me. And I said this and they responded, but I said, I need you to say, Jess, when you're ready, let us know when you can come back. And that was at the 14-month period. And I went back 3 days a week, a half a day. So I went in, I had lunch with everybody from 1 to 2. And then I was in from 2 to I think 6 or 7. So I only went back 4 or 5 hours. What happened was I went to one of our different clinics and they have overhead LED lights. I now know that that's my kryptonite. I cannot tolerate overhead LED lights. And I did not see this coming at all. So I ended up back in the New York Eye and Ear Infirmary emergency department on Christmas Eve, 2014, because I had incredible eyeball and facial pain going back to work. I actually started wearing sunglasses inside. We went completely green. We've won awards for our green and nature connection in New Jersey. And these overhead LED lights has nothing to do with brightness. I can be in sun, I can be in Vegas. It has everything to do with LED lights that come directly perpendicular down from the ground. If they're inverted or indirect, I'm completely fine, but I cannot tolerate them. And I went back to the ED at that time. And then we realized in January 2015, it was incredibly painful. I had to leave work after coming back.
And so at that point, what's your outlook?
At that point, so not a lot of people know this, but on that point, I had to leave work on that day. And I think if the day happened inversely, I think I would have been probably admitted somewhere for mental health concerns, but it happened inversely. I left my job at the end of that day. In the earlier part of that day, the American Physical Therapy Association, it was January 15, 2015. I can tell you exactly what day it was. And they asked me to be one of our national spokeswomen on that day. A private company asked me to do a concussion program for them at that time, based off all of my social media outreach and activity. And then we had a big conversation about not being able to stay at work about 6 p.m. that night. So I think if that day happened inversely, and not a lot of people know that. So that's what happened on January 15, 2015. Well,
and I mean, as a social worker, I feel like I've been beating this drum for a decade now, but the mental health, the mental health drain for any person to have, cognitive, vestibular, the whole gamut of things that somebody is working through with a brain injury. The mental health piece is so important. And for so long, there has been absolutely no coverage no social worker component. That I think that mental health piece is huge.
Yeah, I did have a social worker on my team. I had a neuropsychologist, a social worker, 2 physical therapists for orthopedic and vestibular issues, a speech language pathologist, and a talk therapist during that time.
And so, if you had to pick, were they connected to each other?
Yes, they're all through except for one through NYU. I did leave to go get some private care with a more specialized manual therapist, physical therapy, at my 9-month mark. That significantly helped with my pain for my whiplash, for my cervical spine. And so that was the only thing other than my talk therapist, who I had as a coach prior to the injury. So he knew myself, who I was before as a resident, as a guest partner. And then I got promoted to junior partner. It was like the hero's journey, right? I was like my mom was like a single kid, for an only child from the Lower East Side, a single parent, one of the first to get their doctorate in my family, or the first to get my doctorate. And, it was just like one thing after another. So
when did you start feeling like, with the hero's journey, sort of the upslope is under your feet?
Well, I went through COVID like so many of us did, and then I felt like I got taken, the carpet swept out from under my feet again, and I lost 90% of my practice. So it was a side hustle. I started doing concierge practice full time, or it was really part time if you look at it in terms of hours, because that's what I could tolerate. So I was doing that 2014, 2015 to literally May of 2020, and 90% of my practice passed away between end of March and May 6th of 2020. And at that point, I made a decision of saying, Jess, what do you really want to do? Because I had patients no less than 4 years and some 11 years. I staffed their homes with 16 of people as a care manager in some of them. And I just had no desire to rebuild that again, from an energy standpoint as well. And someone who's immunocompromised and lives with persistent symptoms like myself, I just had no desire. So that's kind of where I ended up, and that's where the story kind of takes place today.
So you have the successful blog, you have connections all over, you're seen as a team leader out there. What was the next thing that you decided to create? Or actually, no, let me go back. There's a virtual image that it truly went virtual in our world. And you want to pull that up, because
sure.
You've now explained the story behind how you created that image.
Sure. So let me share the screen with you guys, and we'll do that on our second screen. And then hit play here. So can you see that, Kat?
Yeah, and if you're only seeing a section of it, there's a drop down that says view options on Zoom, and it's fit to window. I actually watched an entire presentation seeing the lower left corner the other day before I figured out fit to window works.
And I'll send this to you as well, and you can put it out either on Facebook or social or Twitter or Instagram or something if people want to take a look at it. But essentially what happened was I saw this cover on British Journal of Sports Medicine. And as so many, I think people can connect to, with MTBI and concussion, you have, unlike moderate and severe TBI, sometimes, not all the time, but you have this self-awareness of that. You feel like you're losing your mind. So for me, it was so important to virtually connect and keep my brain. And a woman that was who had like ADHD, like growing up, or really was diagnosed as a learning disability back then, connecting to, keeping cognitively sound. So I was trying to read as much as I was able. I was attending virtual conferences on social media. And I saw this cover on British Journal of Sports Medicine, and it was an elephant with a cartoon of doctors touching the elephant blindfolded. And it was saying, oh, this is a wall, or this is a rope, or this is a curtain. And I was like, wow, that's just like concussion. So I found a wonderful cartoonist in London that I still use to this day. And we created this because that's just how I feel, how kind of going through the trajectory of healthcare is for a lot of patients these days, even to this day.
Yes. So, and all of those people were involved in your care. True. Yeah, that was my life. That was my life for 14 months, and I've still undergone
some maintenance care throughout the years. I still go back and see folks. I live with dysautonomia. I have ocular motor issues that I still get tuned up every once in a while because I believe in the neuroplasticity of the brain. I learned to I still to this day learn to manage my neurofatigue. So,
and one of the things that I'm learning another piece of, which you're not there yet, but at 54, I am learning, for me and for others, the menopause is another stage where some, and I don't know the statistic, but that, suddenly there's an influx of hormonal changes, and one is dealing with symptoms again that they didn't expect. And I was actually just started reading up on menopause and TBI.
Yeah, I think it's an important conversation to have. And I think it's also important for women who are athletes like myself, who had an irregular menstrual cycle, to also have if you're in that persistent phase, get a neuroendocrinologist. And I'm very tight with my neuroendocrinologist. My whole medical team, we're tight. But we've been through our journey together, and I just want to keep going. It's either I'm missing a chromosome or there's some kind of grit and resilience, from growing up.
I did think, as someone with ADHD, I did think the scoping review recently that finally looked at the connection with ADHD and concussion, and how many with the mild to moderate concussion, TBI, that post-concussion, they were picking up people that had ADHD before.
Yeah, I think that was part of my journey as well. I think in terms of the learning disability diagnosis, I was a kid that used to take 2 and 3 hours to do homework. My mom would call the middle school dean in 6th, 7th, and 8th grade and say, why is there 3 hours of homework for like a 12-year-old kid? Like, what's going on here? And they're like, Lisa, we're just providing like an hour of homework a night. And I would just sit there. I was an athlete in me. I just knew I had to get it done. And I graduated 4th in my class, don't get me wrong. But I just learned to sit there longer. So it really wasn't until my junior year of high school that I got diagnosed with a learning disability, because I didn't want to have the stigma associated, like the other kids in my class that, would have extra time. But I'm so glad that I did. I didn't really learn how to manage that really until grad school.
And it is interesting because the risk factor, along with sex, being female, I've seen ADHD and learning disabilities, appear on the list, appear modified, appeared with a parenthesis, and like it's been something that over the last decade, the pieces haven't been put together. So I do think it's really important that we continue to do research on that piece. So I want to bring it around to what you're doing right now. And with this background that you had before your injury, the injury, and then the recovery period and your journey, where is that brought to you today?
Wow. Yeah. So as I shared, 6 weeks in New York City, not to trigger, but that was very intense for us over here with my loss of family and basically my practice. And I just really had to, and I had some cancer surgery as well in July of 2020. So you can imagine the country was like burning down at that point. Literally outside my hospital, there was like a police van like burnt down at that time. And it was just like, wow, there's so much happening in this world. Personally, globally, we're all kind of going through something, like just connecting to that. We really all need to be kind to one another. But it was like, everybody calls me Jess for folks that are here, but I had a Jessica Schwartz conversation with myself in nature. I got lost and spent a few weeks really talking about with my partner as well, who has the double BFA in graphic design and 2.5D and 3D animation and web development. And we said to Jess, what do you want to do? And it was like walking through the woods of Maine, and I was like, yeah, I really want to be back into concussion education full time. Like if that's the goal, I would like to be able to work remotely anywhere in the world and just nurture thought leaders in the rehabilitative healthcare field. And how can we give them access to just robust educational programming that takes advantage of everything that we should in 2021 and 2020 with all the technology that we have. So that's kind of what happened. I I reached out to a lawyer and I trademarked the podcast and the term Concussion Corner, because I always say it takes one crazy person to run your life, right? I'm not independently wealthy. I live in a rent controlled apartment in New York, right? But all of this stuff looks very glamorous, from the outside world. And I said, how can we do this properly? So I formed the Concussion Corner Academy, and we're going to have our first cohort in January of 2022. I just hope we can disseminate and instill compassionate care collectively for an interdisciplinary group of colleagues, internationally.
And so for the Academy, what type of students would be appropriate to apply?
Sure. So really looking for anyone who has direct access to people, right? So we're looking to educate folks who can do comprehensive and targeted physical examinations on folks, really ranging from everyone from social work. And I'm starting with social work first because you're here, obviously, and you've given me some clout throughout the years for not including social workers. So I'm going to start with social workers just to start here.
And that actually is true, because you had that other thing and I'm like, where's the social worker?
Exactly. So, Katherine has put me in the virtual noogie, and I look up to her tremendously, and I listen, and especially as my mom being a social worker, but very, very important, because as I practice at my practice physical therapy to go and done a lot of concussion consultations throughout the years as well. I found that folks living with persistent symptom, on average, we're seeing 6 to 10 providers before they reach my virtual door, right? I came to their homes. And what I was finding is that the mismanagement of concussion patients with persistent symptoms was much more prevalent than the well cared for patient. And I said, this can't be. And I knew that trajectory. And I was so fortunate to connect to it, even though it felt like forever, that I was only mismanaged for 2 months of my concussion trajectory, where I have friends and colleagues that I've seen like upwards of 60 providers, right? So I talk about social workers first here because I actually just had a Canadian social worker reach out to me this week, and she's like, why should I take your course? And I said, because you guys are the ones that when persistent folks come in with suicidal ideation, they feel like they're crazy. They don't know how to negotiate their space and environment. They've been told or alluded that this is all in their head, or they've had some iatrogenic suffering inappropriately or not directly or purposefully mismanaged by the healthcare continuum. It's the social workers at that time who are going to do the mental health intake and then potentially save that person's life. And then we need for you guys to know whom and how to get this rehabilitative injury. This was deemed a rehabilitative injury in 2017. Even though, just as an aside, as physical therapists, it's our centennial year. We are 100 years old as a profession. We were female rehabilitation aides in World War I in the trenches treating TBI. And wow. So we've literally been moving brain injured patients for 100 years, literally in trenches from the war. And we do it in the ICUs. We get them up, we get them moving. We do not tell people to cocoon. So why have we been doing this for concussion anyway? That's a whole separate Facebook Live. So the social workers, so physical therapists, athletic trainers will get 24 hours of CEU in all 50 states. We will have a live component on Sunday mornings at 10 a.m. Eastern, which will allow for European folks to come in, East Coast New York and Canadians. And then the West Coast Canadians and Americans also have a 7 a.m. time slot, which I think for healthcare providers is okay. You grab the coffee and you come in pajamas and you'll get to meet myself and the faculty for live Q&A, something like this. So it's not a plug and play. But PTs, OTs, speech language pathologists, osteopaths, neuropsychologists, social workers, physician assistants, nurses, it's for an interdisciplinary crew.
And it sounds very much like the graphic you showed, that you have the different professions coming at brain injury, but a conversation happening.
Yeah, absolutely. Yeah, right. So essentially my belief system and my values here for this program is to really deliver this ethically. And so, what can I as a physio do for our mutual concussion patient? What can you do as a social worker, a speech language pathologist, an OT, a physician, athletic trainer, neuropsychologist, neurooptometrist, the whole crew? What can you do as that provider? And then how can we 360 treat this patient together, not your patient, not my patient, but our patient. And we'll talk about individual versus collective competence, which is a theory from a PhD rhetorician in Canada, Dr. Lorelei Lingard. But we have very individually competent clinicians, but you often need a 360 on how to treat these folks, especially these 30% of folks, up to 30% of folks living with persistent post-concussive symptoms. So again, we see folks a year out, we see folks 5 and 10 years out, and we're able to treat them. Either the brain wasn't ready, they didn't have the proper care back then. We didn't know. You have to know what you're looking at, so you know what you're looking for with this injury. 360. So I'm very proud of what we're able to offer, and then our faculty is kind of all-star as well.
And I think you point out, I mean, I sometimes struggle with the term mismanagement, because the individual players, the individual practitioners are doing the best they can from their fractal. So I sort of sometimes feel like it's splintered care, fractaled care. Like, it's like the disco ball is on the floor and each mirrored piece sees only what it sees. It's not together creating a whole vision. That may not have worked, but a broken mirror. It's just all these little fractured pieces of views in, and the only person to connect the dots is actually the patient, which is really hard in your brain injury. Also, if you're a mom, but you get the mom with the thick notebook, and then it's the person that's pulling the care together almost gets demonized in some in the past, and that's been a really hard struggle too. So who pulls it all together?
Mickey Collins says this over at UPMC, and they're seeing about 20,000 patients a year there. And he said this on a conference once I attended virtually, and he said it's not about the highest degree in the room; it's the smartest person in the room that can take care of this patient. And if you're in a square state in the middle, welcome. We have the same issues in New York City, in an overcrowded city. So same thing internationally in Australia, New Zealand, Europe. It's the same conversation. And I agree with you on the fractured care. I also do stick with the mismanagement word. And the reason why I do is because I've had so many patients suffer from words that were delivered from a provider's mouth. And
absolutely, the CTE piece and some of that, one year you won't get better. Absolutely. And I think on some level, it that particular person that created those words or created something that was misheard, and I unwind a lot of that. So from that standpoint, yeah.
Yeah. And again, it's, I've heard it all. I've heard folks in abusive relationships been told to rest or just get out of the house. And obviously we can talk about that for days. We've had construction workers have been told to lay down on a bag of concrete. I mean, just the wildest things. That's also a slide. So come in January, we can talk about all of those things. I have a slide, but I'm so proud of it. And the other piece is that I'm using a learning management system that I'm quite proud of. It's 2 PhDs in Greece. So I have to wake up really early to learn how to do all this. So in Greece, and they have PhDs in educational technology. So it's actually going to be an interactive course as well. So we'll have an async, and I've done this in the past, and I'm purposely dosing this type of education designed for the working healthcare professional. So it's not going to be like 6 to 8 hours like I've done a week in the past. It's like too much. Like nobody has time for that. Like if you're of an age where you know what that meme looks like, nobody has time for that as a working healthcare professional. I created this program thinking of the parent, the full-time working human with like a naked toddler running and screaming in the background. Like that is who I've designed this for. So it'll be an hour of asynchronous material. My partner is again a graphic designer, so we're going to have beautifully curated contents with lower thirds and call outs and interactive questions in our learning management system. And then we'll also have a live 1 hour component on Sunday mornings at 10 a.m. Eastern. So you can meet myself and the faculty, and we'll have 2 days a week of live office hours with myself. So I really think, on top of, we can talk about the nonprofit partnership as well, but, and the research component, please. We talk about the research.
Excellent. All right. So as you can see, Jess and I have no problem speaking with each other. I think we've done several 3-hour conversations for your podcast. I do have a hard stop with a client at 3 today. And so I want to also be aware of your time. This is being recorded. I'm seeing people jump in, the numbers of people watching keep climbing. So if you came in late to this, I will probably get it up on the YouTube channel by Saturday. But I wanted to give some time for folks to ask some questions. People did ask for your contact info. So maybe you could put that in the chat just while, if you want to raise your hand, if you have a question. And Kara, do you have any questions from the chat that I missed? I was going along for a little bit there. You could just raise your hand this way or unmic if you have a question you'd like to ask Jessica. Dr. Schwartz.
And just while we wait for that question, Kat, I just want to say that we're submitting for IRB approval. We're going to be studying our students, our healthcare providers, and giving that data away. We're looking at rehab provider self-efficacy and management of concussion, and evidence-based practice profile questionnaire. So we're going to be actually studying our students pre and post our programming, and then looking at them 6, 12, and 18 months after. And we're actually giving that data away. There is no funds transferring because we want to make sure we're delivering gold standard in education.
The other thing I want to mention is sometimes people are more comfortable in the chat. What I will always do is copy the chat after the room and send it to the speaker. So if there's a message of thanks or questions that you have for Dr. Schwartz, you can put that in the chat space and I'll get those over to her. May, you have raised your hand. Hi, May. Do you want to unmic?
Yeah, sorry. Hi. I just want to thank. Oh, I guess someone else.
That's you.
Oh, okay. Hi, I just want to say hello. Sorry, I'm not putting the camera on because I wasn't, I forgot about sorry, my brain is not functioning. Anyway, I just want to thank you and thank the speaker because she is 100% right. Mismanagement is the correct word because I've been mismanaged for almost 5 years, and her story, it's reflection of mine. And I'm really hoping that the course that she will be providing, that's a lot of the folks in Canada, and I'm hoping the military would participate in that because it is so accurate. You don't know concussion until you're part of it. So thank you for what you do, Katherine, and then thank you for the speaker. I'm so sorry, I forgot your name.
I'm Jessica May. It's nice to meet you.
Nice to meet you, Jessica. I know exactly what you're talking about. I was a physician, I am a physician assistant, and it's a nightmare when you know exactly what you're talking about and nobody else can listen and you know what's going on. So thank you.
I appreciate that more than you know, May, and just please note that it's just me. It's just hello, and my partner Carolina, and we are in the process of also applying to sam.gov. So we will hopefully be able to be approved for that either this quarter or next quarter. So we'll hopefully be able to for Veterans Affairs.
And I do want to just promote one more time that I did put up today last week's session where I spoke to Ashton and a Marine who had a TBI from horse when she was young, diving accident when she was in high school, and then a couple of TBIs through her career and 2 deployments as a Marine. And so that's up there today, and welcome people to watch that and share last week's show. Jessica's show will be up on Saturday. Kara, are there any questions that you'd like to?
Yes,
Jeff?
well, actually, and hi, Jess, how are you? It's nice to
Hi,
see you.
Kara.
Um, I see, and I'm very excited to learn more about what you're doing. I think, coordination of care and access to all the different specialists and all of that. If you're in, an intensive, like at Ross, like a brain injury day treatment program, something that's more holistic, but that is more for severe cases. And so I think for mild to moderate, it's definitely more tricky. I see a question in the chat that someone has worked with individuals with brain injury for almost 30 years now, and the most persistent problem she sees is lack of knowledge with other healthcare professionals regarding brain injury. And so I think that it's great that you're taking this initiative. Like, how are you sort of like promoting this? Are you getting a good response? Like, how is it that you're able to accomplish?
We're just doing this word of mouth care. Like, it's just like, you guys take it and run, and we're doing this word of mouth. And we have instead of doing early bird specialists, because I'm not a major organization, we have an affiliate program and we can help folks out. It's like the local bakery. We want this to feel small. We want this to always feel intimate and connected. So it's really just word of mouth. I don't have a marketing budget. So I come on and do things like this. And we have a tremendous faculty. Our first cohort will have 2 weeks with Christina Master out of CHOP for our pediatric section, John Letty for 2 weeks, Lenore Hergetz out of MGH and Harvard for PT examination, Kara Baxter out of Park City, our former US ski and snowboard PT for PT intervention, Dustin Fink doing athletic training, and Brenda Egan Johnson doing our return to learn. And then in our fourth quarter, we'll also have speech, OT, neuropsychology, legal, this vestibular and some cervical spine from our Australian physios out in Q4. So we'll continue to grow, but those are our two beta programs. And as long as we have 10 providers, nurse, social work, PT, AT, OT, we're happy to CEU it as well. I just need 10 to do that because it's an incredible amount of work as a one lady show over here.
Well, absolutely amazing. Another question from Lisa Kurth is that, do you find that, this is back to the attorneys, do you find that some personal injury attorneys lack proper education regarding TBI protocol for treatment and for appreciating persistent symptomology? I know that there's some attorneys that specialize, like Stephen Benveniste in this, but people like that are rare and far between. So
I think this is definitely a place to build up and not tear down. I think that's a 360 issue. I think it's a 360. I think there's physicians who are great. I think their PTs are great and everything in between. But I think everyone can always have space and room to learn, especially the nuance of the closed head MTBI concussion world.
And the ever changing. I mean, it literally has changed so many. I mean, it's if you look at how many articles come out every single week in TBI, and it is slowed a bit. People's research has been slowed a bit by COVID, but scoping reviews are now coming out where they're looking at all the literature in the past. And we just mentioned that it takes 10 to 15 years to get that research from research into offices where it's in practice. And that is an entire science of implementation where the research is taken. And a lot of what I've been working on the last decade is trying to get the research to the right people. And there's no money in it. We don't have a pharma. We don't have that slide where somebody's working on that. So, and there also is a list.
Can I just comment on that, Kat?
Yeah.
And so just to comment on that, Kat, because I think that's so important. That's kind of why I did this, the way in which I'm doing it. So we will have nonprofit partners throughout that we're going to support, because folks like yourself are like doing the best you can, but running a nonprofit, is wild. And so many folks have really good lanes. So how can we support folks 360 and then have our healthcare providers who are learning from us get connected to folks like you, to PTSD in women, to brain injury in women? There's so many lovely nonprofits for brain injury out there, but how can we support? That's another thing that we'll have forward facing and back facing. We'll have nonprofit partnerships throughout that is guaranteed that will never change.
I think it's really amazing. like an advocate at the same time that you've become, such an educator and, a clinician. And, so thank you so much. I really appreciate that. One question from the beginning that I just didn't mention is that besides the CAT scan initially, was there any other further imaging performed for you?
I think I just had, I shouldn't say just, I had a follow-up MRI for my spine, I believe. It was either head or spine. I know I had an MRI somewhere in there just because at like month 9, because I had some persistent stuff going on.
I did through like a research. I was asked to participate in research or different programs like that, and did like an fMRI. I did, but it was just because I was part of like a research study kind of thing, which was interesting. To see, but I don't know how much, that kind of treatment or
what was that value for you, right, Kara? Like for me, like the value was in the rehabilitative care, those rehabilitative teams that quietly got me back to being able to perform and do something like this without getting distracted, right? Because you and I both know directly that attention is our most valuable resource, especially as women. We just don't want to feel less than, especially in a crowd. So I know you've had on the past, but like we're always told not to talk about our brain injury. But we've got to start breaking down these stigmas, because for folks that, are able to perform, you've come so far. So I am so just your champion as well.
I do want to give you a chance for a closing session, and literally we could talk for 3 hours. We'll definitely have to have you on again after after you get going and let us know how it goes. And I think we do want to acknowledge the doctors out there that are reading the journals, that are trying to putting together, those that have put together clinics. They aren't making money. The number of clinics I know that have opened and closed, it's not a moneymaker for the doctors, and it's a really tough space to be in. So I want to acknowledge those that are working so hard, and that we have people like Christina Masters, who's been on this show twice now, and John Letty, who's spoken at a number of our events, and Brenda's been on, and there's so many people out there really working in this space. And there are those that, there are the other group that don't know, haven't made the effort, and are looking through this very fractional point of view where they don't have that 360 that you talk about. So Jess, the last 2 minutes are yours.
Oh, just like that, we're done. Okay. All right. Well, I just want to thank everyone just really for their time and attention. What I can say is, I really just want to make sure that we always have this mission-driven connection to why this academy now exists, is that I do not believe that there are other interdisciplinary programs like this out there that are going to be internationally connected. And I just want to make sure that we're doing this with the central tenets of our tagline, or mantra, I should say, of teach one, serve many, and that we're here to serve the concussion community. That again, we know the stories of so many, and there's millions more, I'm sure, with stories like mine. And how can we, again, how can I serve the patient that's in front of me? How can I get them referred to out the get-go, straight out the gates, as a direct access provider? If I'm picking up yellow and red flags after I've learned how to do a comprehensive targeted physical examination. If I'm not a provider that does these physical examinations, I sure as heck better know what they look like and what the gold standard of that looks like, and how and whom I can refer to in that moment in the right time. If you're a mental health care provider, if you're OT, a speech therapist, or you're in COG, all the things. So we really have to understand what gold standard in care looks like, and that is going to change immensely every 2 to 3 to 5 years. But at the end of the day, the central tenets of a good comprehensive targeted physical examination, looking at ortho and neuro and cog and behavior and sleep and all the things phenotypically and genotypically, how do we get folks to the right place as quick as possible so people do not suffer? And concussion is a loss of I am. And I say this with everything in my soul, is that we need to be able to validate our patients' symptom profiles. And if we validate their patient symptom profiles, they do not feel crazy. And therefore, we can take those somatic driven feelings that they're having of going through the supermarket and feeling like they're in a fishbowl. 15, 20 years ago, we would have sent them to psych. When we don't know what to do with someone in medicine, we allude that they're either malingering or crazy. And we need that to stop right now in 2021, that there's no reason for that. So here's what I can do for the patient, here's what you can do for the patient, and here's what we can collectively do to treat and advocate for this patient and refer in a proper pathway. Because again, there's not many of us that are doing it really well. But how can we, again, teach one, serve many, so then we can properly help these folks out on an international basis, because the suffering is real internationally. Medicaid to professional athletes and everything in between. You know, how can we advocate for these folks that cannot advocate for themselves? And I hope that was 2 minutes.
I'm excited. I'm excited to part 2 of this, and definitely check out everything that Jess at the we just do your real quick your URL again.
Concussioncorner.org. Say hi on all the social medias, Concussion Corner on Twitter, on Instagram and Facebook. I'm DPT to go, Doctor of Physical Therapy, the number 2 go, on all those platforms as well.
And
please say hello.
I'll have that on the YouTube video too. So thank you so much, Kara, and our IT person in the back, Jennifer, and IBIA and Navis, and everybody for allowing us this, and for you all to keep showing up week after week. We have a really interesting presentation next week from Ohio State on contextualized rehab. It's gonna be really great. So thank you, everyone, and stay safe, and see you next week. Bye.
Thank you, Kat.
Take care. Thank you, Jess.
Thank you so much, Katherine and Jessica, and everyone who's been helping. Bye.
Bye, Connor.
Hi, Connor.